the State Health Management Information System Officer. Please put your hands as I invite the officer to come and handle the next session.
The Honorable Commissioner here present, the Permanent Secretary, State Ministry of Health, and other Permanent Secretary, traditional rulers present here, all directors from agencies and State Ministry of Health, directors from from primary healthcare boards, and partners, program officers. Good morning, everyone. I'm going to take presentation on the last performance dialogue meeting tracker. That's the first presentation I'm taking. Then thereafter, I will take the state scorecard for quarter 4 and quarter 1. That's quarter 4 2025 and comparison between quarter 4 and quarter 1 2026. I'll be taking the tracker first. PDM, Performance Dialogue Meeting. PDM, the one with PDM. All right, before the project, let me thank you. All right, this is the activity tracker for last quarterly performance dialogue held in January 2026. So this is the activities. Activity number 1 said LGA to conduct monthly performance meetings, and the responsible persons are the DPAC and LGA M&E officers, and implementation status for these activities is 80 to 100%. Then the next activity is State Ministry of Health to have access to list of existing data validators, and the responsible person is the state HMIS officer, and the implementation status is 50 to 75% implemented. Then the next activity is refresher training for data validators. Responsible person again is the state HMIS officer and not implemented. Then the next activity is strengthen supervision and oversight. Strengthen supervision and oversight. Basic Healthcare Provision Fund State Oversight Committee, and the DPRS is the responsible person. Not implemented, to be conducted by end of May. The next activity is implementation of PSC under one roof. PSC, Board ES, and DPRS. So the implementation status is 50 to 75%. And the next activity is production of data tools. And the responsible person again is the state HMIS officer. Implementation status is 50 to 75% implemented, and the mark is memo raised and submitted. Then the next activities is developing an accountability framework, coordinate. Okay, the responsible person is to be coordinated with agencies, and the responsible person there is DPRS, and implementation status is 0 to 45% not implemented. Then advocacy to the LGA chairman on budget implementation for health activities, and the responsible person is, the responsible agencies are State Ministry of Health alongside local government and chieftaincy affairs, and the implementation status is 80 to 100% implemented. Then mapping of data validator, TWG, SDO, implemented 80 to 100%. Then conduct of LGA joint annual review, SMOH, DHPRS, and SDO, not implemented, memo raised and submitted. Then the next activity is inviting members of tertiary institutions and private sector for the next quarterly performance, and the responsible person is SDO, and 80% to 100% implemented. So far this is the tracker as of last performance dialogue. So I'm going to take the next presentation, which is which is scorecards. RAMCA plus N scorecards for quarter 4, and then we'll now see quarter 4 2025, and then we'll now see quarter 1 2026. So this is quarter 1 2020. Please project quarter 4 2025 first. The one with 0 and blank. Some of them we have 2 reports, that's for 2 months in that quarter. Some of them may have 1, some of them 0, but the performance now is the colors red, yellow, and green. So these are the facility under each LGA. All the health facility reporting on DHIS2 are the ones here. They are the ones called for the states. because we registered them on DHIS2 and it will just be uploaded into the school card automatically. So not reporting contribute to pulling down the state school count down. So far, keep scrolling for this is the LGA facility copy, and then we have the state level, that's LGA state level scorecard that shows only the performance for the 17 LGAs. So this is the state LG for quarter 4 2025. So far, can you scroll faster so that we'll see it at a glance, and then you project the state's copy, the state LGA copy. So this is our performance per LGA, and this can be shared on the platform. We're going to share it on the WhatsApp platform. So this is the end. Can you now project 2026? I want us to see the comparison. If there is any improvement, we can view it. Quarter 1 state LG facility, quarter 1 LG facility. Quarter 1 LG, just this same thing, but for quarter 1 2026. All right, this is quarter 1. So, you know, if you are being observant, you observe that the green there is improvement because there are more green in quarter 1 2026 following subsequent performance dialogue and the discussion. Have triggered some kind of improvement in this quarter 1 2026. So can you keep scrolling for all the, if there is a way you can. Okay, lantern. Okay. Keep scrolling. Keep scrolling. This is just south. This is just south. Canal. This is Kanki. Okay, this is Lantern North. This is Lantern North South. All right, thank you. Keep scrolling. So keep scrolling, Esther. PT2 uptake for the ANC. And then the other indicator under maternal health is the skill birth attendance. This is another indicator that the state's report is being affected due to knowledge gap. Because when we were having trainings, last time we trained some medical record officers, and then we tried to test their knowledge to know if they actually know this, what the skill birth attendance stand for. Some of them were saying they are TBAs and likes. We have a lot of facility delivery that are not reported here. They assume SBA is skill birth attendance. So that in turn, that knowledge gap in turn is affecting the score here. But then we are working seriously on that to see that we improve the capacity of the data collectors. And the next one is newborn. Under newborn, we have postnatal care for first and third visit for live births. And then the next indicator is for FP, family planning. And under it is new LAC and FP, long-active reversible contraceptive, FP users. And then what is mentioned here is, again, for child health is ORS, zinc for diarrhea, and then percentage of children with fevers as pneumonia. So under child health, this is the indicator. And then birth registration, we are very poor in these two. Before now it was 000, but we are still working on that, because when the NPOP comes to the facility to register the children, they take their data away. Meanwhile, there is NHMIS birth register that is at the health facility there, but our health workers don't use it. So we've trained them on that, and it's coming up. Before now it's 00, because NPOP usually go with the data and we don't have facility copy to report. But now they are aware that they're supposed to report or register children. And then the next indicator is malaria. So under malaria, what is being measured again is MRDT microscopy testing for under 5, and then ACT treatment for malaria under 5 also. And then the next is immunization, another indicator that is mentioned under this RAMCA plus N. This RAMCA plus N is designed from the national. I did not actually design. I only contribute in getting my state data and then upload it into the already designed template by the national. So the indicator here for immunization is BCG and fully immunized. And then the next one, that's the plus N nutrition. We have exclusive breastfeeding, and then vitamin A for second quarter. And then we have post-abortion caregiving as an additional indicator for this RAMCA as designed from Federal Ministry of Health. So this is it. Can you scroll for us to see quarter 4, 2025 for LG? This same one, scroll down. This same one, please scroll down. Let's see, and then we'll go to quarter. So we'll now see the comparison. This is quarter 4, 2025. Then the next one you'll be giving me is quarter 1, 2026. That's state LG, quarter 1, 2026. So before now, when we started performance dialogue, it was just red color we're seeing here for the state and LG performance. No, state LG copy. Before now, the rate were too much when we started this performance dialogues. But with the discussions here, we'll be having a series of discussions with the LGMIs, who are the custodians of data in their LGAs, and when we mentor them on so many things they weren't aware before now, we find out that it's improving over time. So, Q1 2026. All right, this is Q1 2026 for state LG. State LG. So these are the indicators again, just like the one I read in Q4. They are the same indicators measured here. So can you scroll for us to see the performance for Q1 2026? This is the recent scorecard for Q1 2026. Q2 will be ready, maybe there sometime around May or thereabout, or June. So this is Q1 so far. Scroll to the LGs. So subsequent quarters, Just Not was leading in BAT register, but currently Mango is leading. And for skill BAT attendance, we can see, since we are still doing the mentoring on this particular data element, we are still where we are, with a little shift. And then ANC1, there is a little shift in particular LGE. So this is just, women don't come to the facility. They actually come in good number, but they don't come early. They will come when the pregnancy advanced to 20 weeks. And it usually affects us because that is what is used to measure here. So this is it for Q1 2026. Can you scroll? Scroll for other LGs. So this is it so far for the scorecard. And I think I will take a bow after viewing the scorecard. Thank you, sir.
Let's appreciate her more, please. That was a very technical presentation. Only those of us that are personnel from the health sector will understand some of the abbreviations there. But from her own explanations, I hope we are getting the gist. And so thank you very much. While the first and the second presentations were on, we were blessed to have the presence of the representative of the Commissioner of Finance, ably represented. That's the Permanent Secretary. Please put your hands together for her. You're highly welcome, Ma. Thank you for gracing this session. We also had the Executive Chairman, Kankia Local Government Council, ably represented here. Please put your hands together for our mommy who represented the local government chairman. Ma, thanks for having you. All right, please, I beg your pardon. We will be continuing, but let me have one or two other dignitaries that are here. I will acknowledge them. Let me have a word with the organizers, please. DJ. hands together for him. Sir, you are highly welcome. And the man that said emphasis should be laid on the report from Lantang. South. Analysis for him that time to know and observe appropriately. He is not any other person but a representative of the House Committee Chairman on Health, Plateau State House of Assembly. Please put your hands together for him. Sir, you're highly welcome. And it is on that note that we move to the next item on our agenda, which we are going to be taking questions and answers, and we will be starting with the Q4 performance dialogue tracker, and then we will, or for both, anywhere you have questions to ask from the last presentation, please do well to indicate. Help us with another mic, please.
Good morning, the Honorable Commissioner for Health, the Permanent Secretary, the State Ministry of Health, the representative of the Bongbong Jos, the representative of commissioners present, the representative of the Chairman House Committee on Health, the representatives of the heads of tertiary institutions, also the representatives of heads of agencies, the representative of the local government chairman, and the directors of the State Ministry of Health, directors of all our various agencies, our program officers, partners, and our dear fellows, Cohort 2.0. Good morning, everyone. So, it's our usual custom that we do our plenary, especially after we have reviewed data that has been presented. Please, let's still have the data on the slide, the last data. So we are going to have conversations regarding this. I know many of us have written questions, we've written our observations and even clarifications that we need guidance on. And so we will just open the floor so that we can begin to have those conversations. So let us not, we're used to these conversations because the hall is quiet. So let me start moving around. So we're going to start the conversations.
Firstly, I want to apologize for coming late. It's not in our making. I just observed this morning's conflict of activities on my decks. We're having some little issues. My main place of work now is with traditional leaders. I'm one of you. So the zeal to ensure that health services are moving on the Plateau is still in us. It's on this note I want to apologize for coming late. Please and please, it's not in our making. You will permit me to honor the protocol that has been established and to quickly put our own voices from the State House of Assembly that we are together with you people. We're in support of all what is going on. Notwithstanding, yes, we have a legislative framework regarding data. We are doing the work together with you people. Very soon we will round it up. The good work is there. I appreciate all what everybody is doing, and I will be very biased. I appreciate the director of primary healthcare, Lantana. I was told he's here. If I do that, I will appreciate that of Lantan South. Then the appreciation extended to other local governments. I have concern. My concern human resource inadequate. Human resource inadequate. Now, with the recruitment that has been done, those of us that are on the other divide for now, the only thing that will show government is working is to see the improvement of this data, because recruitment has been done. From the analysis I've done, I observed that the health management information officers are grossly inadequate up till now. They are grossly inadequate. I think in the last recruitment I was told there are 17, one per LGA. If really the business we are doing, the people that will help us clean it well are these specialists, are the experts. So it's on that note that I felt if we are alive and all things being equal, let's see the impact. Not impact now. Let's see the output of the recruitment. In the future, we will get the impact. Now, you see, the nutrition data is a thing of concern. It's a thing of concern. I have that conviction within me that if we eat well, it will take care of other aspects. If we eat well, I will appeal that the officers concerned regarding nutrition, they should work harder. I think I will stand regarding these private facilities that don't submit data. It's very, very unfortunate, that a facility is on the Plateau with all the engagements that were done. I recall vividly in the 9th Assembly, there were lots of engagement. Even their own association, the ministry had engagement with them due to COVID, around 2020. And if up to now, I don't know, but I need to also ask, does it mean that they don't maybe give them to all? See, next time, let's just be frank with ourselves. Next time we won't hear this. It's you that we will hit. That's what the legislative arm will just do. You cannot tell us at this level that private facilities are not giving you data and we are comfortable. It's not possible. Plateau State is not a dumping ground. It's not possible. What these facilities will be doing, they are dragging us backward. And we are comfortable sitting and making this presentation. What is it? Is it the speaker or the House of Assembly members that will go to oversight to that level? Or the commissioner or the PAMSEC? Please, please, we won't take that again. This is part of our oversight. We won't take it again. No private facility on the Plateau will deny us data. You deregister that
facility. Deregister them. You can't give us that headache. There are meanings. We know what data is. The good things you are doing, if you are not there, that gap has been established. What will government do? So you are denying us with those things? So please, director, please, I'm not here with my committee clerk, but I will jot it and I will send it to him. That this issue is on ground. At the inspectorate level, at people's level, please, sir, please. Now we are begging. We won't take that next time. Tell them they should leave our state or they should close that facility. Please. We are not people that will tolerate all this kind of things. Please. The next thing, our presenter, thank you so much. You know, in presentation, there is a way that you capture somebody. At the end, what I expected that there should be an executive summary, giving us a summary of quarter 3, 2025, quarter 4, 2025, and quarter 1, 2026. It's a dashboard. Looking at it on that dashboard like that, I will deduce the progress myself. Not her telling us that there is a progress. When the other presentation, I'm forgetting the data that I've seen, and then a new one came up, and I'm battling with send me this, send me that, do me this, do me that. So next time, let there be a sheet for an executive summary showing the summary of what happened. Probably let's be working with 3 quarters, you know, as it progresses. And let the graph be plotted in a simple manner that I will know that for this indicator, there was an improvement. If an indicator is taken for 3 quarters, let's see the improvement graphically or other distinct. Thank you so much. It's not in our making to come to presentations like this. Very important meeting of this nature, and we leave. I'm multitasking. I never wanted our absence here. I was given notice that none of us is here, and I felt I will come and mark our presence to tell you that we are together. I will go back. You know what is happening. We are battling with security issues. I'm somehow involved in doing one or two things. To be sincere and candid, we are grateful. The one that I said in a harsh manner, please just bear with me like that. We will continue. So thank you so much. God bless us all. Where is the director of primary health Atlanta? I have to shake him before I leave. Huh? He didn't come. Okay, who is from Lantan? Comrade Yahakokumani. We used to be with them. I'm one of fellow from the fellows from Lantan and Lantan South. Good, come now. Give people call it urgent 2K, man. So, don't say urgent 2K, we will respond. Because you people, the fellows, you people have to help us. Thank you. Sima. Well done, sir. Director. Well done, sir. Director. Well done, sir. This is my Oga.
Thank you very much, sir. Please, a round of applause for him, please. and both the LGA report that was presented by the first presenter and then the scorecard. So we're looking at both.
Okay.
All right, sir, please, you have the floor.
Yes, thank you. Thank you once again. Let me first and foremost commend the presenters that presented the scorecard before us. And there are some of the challenges that I saw, and I don't know whether the leadership of this PAC were able to handle these challenges at the time they opened. And if they do that, they would have also told us that these challenges we face, this is how we are able to surmount it, and this is how we cannot talk about it. But mention only challenges and what they do to surmount those challenges, they did not mention it to us. It's like all the challenges they are presenting to the higher authority to maybe solve it for them, which I think is not normal. So, secondly, the traditional institution, I remember the last time when the Council of State met on this issue, they directed all of us to come and offer our assistance to all the PAC that are under our jurisdiction. Now, I know the one in my place, and I know the role I've been playing, and I will appreciate if next time we are also being told, or the management should inform the traditional institution as the PAC in those areas to tell the traditional institution these are the challenges too. Maybe the community can afford to solve them. If the community cannot afford to solve them, then we can give advice. I think this will also help. And let me also say that please, we are making our contribution to see that these health issues are perfectly done in our various communities for our subjects to also enjoy the facilities there. So whatever you have, you let us know too. Like last time we had this, what do you call them, failures. We interviewed them. I don't know whether they have started work.
Yes, sir.
If they have started work, I expected that when they come to the PAC under our domain, they should contact us too. Tell us that we are here, we want to see this and this and that, so that we also give them support. But I think I will also take an excuse. There was an attack in my place. An elderly mother and her first son were killed, and the community wanted to raise the toss and succeeded in coming. Now they have just been told that they are going to bury them. So not waste time with the court, they are going to bury them now. I received the text and I want to appeal that I will rush to my place to attend the burial. Thank you.
Thank you very much. Thank you. A round of applause for him, please. Oh.
Thank you. The Permanent Secretary, Ministry of Finance, representing the Honorable Commissioner. I have one or few questions to ask. And I'm not speaking from an informed background because I'm a lay person. So from the first present, the speaker said, I observed that there is a problem that ordinarily all of us, or rather the heads of the PHCs in the local governments, can be able to cope it. Because, we have a representative here from the federal. I was ashamed, and we whispered each other. What do you think she will take back as a feedback from that information? Because she even asked me, and I said, I too, I wondered. I don't know how that information came about. On the issue of how some people, the money that came into their hands and then they spent it. So what are the measures you do in collecting money, the channels you put in place in collecting money and expending? And if there are measures, how comes that ad hoc officers will collect money and then they cannot report? No accountability. So it reports to us that there is a question mark, we are not handling some of the things well, and there are issues that we can easily handle, not even reporting it here. That is one. Then the second one is the issue of misbehavior by ad hoc workers, which probably by your commitment, it will speak for you to be engaged as a permanent staff, and you are misbehaving, and you cannot even handle them, and you are reporting it to us, while people outside are scrambling that there is no employment. You give them the opportunity, they misbehave, and you still keep them. You expect the governor, or you expect the commissioner, or the permanent secretary to handle them. These are issues that, as subordinates, you are saddled with that responsibility to handle. So I want to pose back the question to you that, to me, I feel it's not something that we can report, because our representative from the federal, she's here with us. I was ashamed. And it's for all of us because we are Plateau people. Then the last one I want to say is this issue of not reporting data. You know that that's a major issue. And you have been having this meeting severally before now, that data is very, very key. What could be the reason that you will not work hard to make your submission, please? And you are reporting to us, this one we could not. What was the challenge to report data? Please, let's step up if we want the state to forge ahead. Because any complaint that comes from the state, we are the cause, because we have been saddled with that responsibility. Thank you. Let me leave the remaining questions to others. Thank you.
Thank you very much, ma'am. Thank you.
The Honorable Commissioner for Health and all distinguished guests. My name is Dr. Bishman Stephen, the Director of Medical Services. I want to talk about the report, the PHC report. I don't know whether that was a reporting template that was given to them. Because what I noticed was just to talk about your challenges and talk about the little way you think you could go around them. But what I saw here, it's they say it is performance review meeting. I thought what they would do was like, okay, fine, at the beginning of this quarter, this is where we were. At the end of this quarter, this is where we are. And then we now say, okay, fine, these are the little challenges we had. That was what we were not able to perform optimally and provide solution. So maybe going forward, you should give them a proper template so that when we look at it, we understand what they are talking about. But you just stand here and say challenges, recommendations. To me, it doesn't really make sense. Thank you very much.
Okay, so sorry for. Well, thank you very much. Where is Mrs. Kunga? Yes, you know, she is the director PHC, does not. And she is the chairperson of all the directors of primary health care for the entire state. I'm sure that is why they gave her that responsibility. Unfortunately, she's working in one local government and she cannot answer for all. But I think there were lots of mix-up in her presentation. I want to assume that it's Mikang that did not present. Was it Mikang? Please, you need to tell us why. And is Ladan here? Primary health care. Monsat, you are here. The director of primary health care of Mikang. Let us know why she didn't send the report. And we must act. Do you understand what I'm saying? I'm sure the message is clear. Please, let us not take this lightly. It's very important. Number two, what Dr. Bishman said is correct. We will not stand up challenges. This one, that one. Where were we? Where are we supposed to be? The truth is that what the HMIS presented is the way to go. We have seen the reds in the columns we are not doing well. We have also seen where it is green. That helps us to now know. I've told her, thank God the swab office is here. Now, we have a challenge. Many of the facilities that are not reporting, there are many factors. One of it is the insecurity she mentioned. There are many facilities in Plateau that just have signboard. There's no structure, and they are on the DHIS too. The primary healthcare, they are aware of it. And we have said it. Let us compile those that are functional. Those that are not functional and effective. Let us send it to the national DHIS and tell them that these facilities are no longer functional. We want to remove them from the DHIS platform. If we do that, some of the blank spaces we are seeing around facilities will not be there. Then we concentrate on those facilities that are actually working, that are actually seeing patients. Then we train them and know how best they will be doing this reporting. But as long as we don't do that, it's a challenge. We want you to help us. I don't know whether it's the DHRPS, the Director of Health Planning Research. Thank God, the person that is there now, I know him very well. I'm also going to call him to talk to him about this, so that we have a seamless platform and we can be able to correctly report what we are seeing. The person in Mangu, I don't know, where is the director from Mangu? She's not here. Because the M&E officer in Mangu local government is the chairperson of all the M&Es. And it is Mangu that is reporting the list. And this is the governor's local government. Please let us improve. I'm sure the governor will be worried that his local government is not doing well if he hears about this kind of report. Similar for me, whenever I hear Kwampa and the report is not very good, I usually attack the director. That is why this thing was particular about Lankan, because that is where he's coming from. So if all of us that are here from one local government or the other, let us push our people that are working in these places. The M&Es, the directors, primary health care, the OICs. Anytime you go home, I always say this, when you visit your village or you visit your area, enter one PhD, ask them what they are doing, try to question it. The health fellows are here, I suppose. And the national health fellows, yes, this is what you people should also carry. So that you keep asking until we get the results that we want. Otherwise, we will continue to get this kind of negative reporting. I heard something about non-payment of salaries. September 2020. So it's just 1 month that is causing us not to be performing. In 2026, 6 years later, we are still not working well because they have not paid us September 2020. Please, let us be serious. I don't think this should be a reason why we are not performing. I don't think so. I can understand that of Bokos. Likely it may be a recent thing. I'm going to ask questions about it, and I'll ask the chairman why it is like that. And like somebody observed, now that we have employed people, we expect that things should be better. We have started training. About 2-3 weeks ago, our Directorate of Planning, Research, Statistics did training for all health information officers, those that were newly employed. And I believe that will translate to some of the reports, because we discovered that many are not doing the right thing. Our institutions that are here, thank God, it is people I know very well. The DC Mark of Jute and Bingham were having issues with institutions. We are not getting reports from them. We have been talking, we have engaged, my people have gone there, but we are still having the same problem. Please let us, you people see most of the patients that are in the state. If we don't have your reports, it will reflect in our data. So if we are getting reports from you, things will be better. Similar for private facilities. Please let us work on this. These are my few comments. Thank you very much.
Thank you very much, sir. A round of applause.
Good afternoon. a different thing. It is not proper. And this other thing is that, yes, we, like in the tertiary institutions, we do send students to most of these facilities, but we discover a lot of things happening there too. Though we also get feedback. Yes, we also get feedback. We are also trying, but we still have a lot of information there too. What are they doing? It should be stepped down. The students are still, they are learning too. And they also step down once they are there. So if we are not doing the right thing, it means that we should get information too. We should get the correction so that we'll be able to correct the students too. But if we, after training again, sending them to the facilities, they're not doing the right thing, what is happening? Things have actually changed, but we should try our best to see that we do the correct thing. Because by so doing, I know that we'll be able to do the right thing. And thank God you mentioned the issue of the directors. She can, yes, the one that gave us the information, she cannot give everything. She don't know what is happening in other things. She just collected the information and then it is being passed. But please, we are learning. Things will change. But at the cost of this workshop, when we end today, from the state down, let us be seen doing the needful. I think it will surely help us.
Thank you very much. A round of applause for her, please.
I greet us all. I appreciate everyone for being here and thank you for the privilege to be here. From the presentation made thus far, there are some of the things that I noted. First and foremost, the commissioner during the last discussion, he talked about issue of sanction. And with what the local government has presented, I think the aspect of the sanction, which we usually the hard stuff, should take place. Because we all plead to apply. And if we are plead to apply, then we should do the needful. Concerning the reporting that they made, technical aspects are expected to be done as far as records are concerned. And if records require a technical person, then it is expected that a template has been provided for this activity. And what are they doing about it? Laptops were given. Why are they not using it? They were trained, their capacity has been built. Did they really understand or did they really know what they were taught? Coming back to join to what she said here concerning the students that normally go to various facilities for what? For experience. If those that are already trained, are already in the facility, are misbehaving, there's this computer language that we have that's called garbage in, garbage out. It means that those that will be coming back for continuity in the system, they will go to practice that which they have learned. Because they said what a child sees you do stick more than what you said. So as they come into the field, they see that those already employed misbehaving, they will take that and say this is a good practice, not what they learned from the school. And that's why our system cannot be corrected, because we don't have continuity. As a development worker, we talk about issue of capacity building and also bring out that which we have learned in the data. Quality of data matters a lot. I think if we are to move from where we are now, then we should go back to the drawing board, then see who and who we have trained, and is their capacity really being built, or do they really understand what they have learned, and then are they able to put into practice that which they have learned? Because without which, then we cannot be able to achieve. If only they will come and present to us challenges without where we're coming from, where we are, and where we're heading to for comparison, then automatically we have done nothing. And it shows that all the money that has been put into this is dropping, just dropping money in the West bin. The issue of employment that was done, there's a program that activity that's going on in the state, which is community-led monitoring, which is an activity that's supposed to be owned by the community as far as the health sector is concerned, to see that the community are being mobilized to go into the facilities to see what is being needed, not to depend on the government, but to see how they can come in. I thank God for the vice chairman for health, on health, that make commitment and also say he can help. I think we should move from that place to see how we can be able to own some of these issues that has to do with us and our health. Because some of the things that he mentioned as far as issue of nutrition, there's also aspect of what? Personal hygiene. So I think there should be more awareness on us to know that if only we can be able to maintain personal hygiene, definitely as far as health issues are concerned, 25% is what? It's taken care of. The other things is for you to know how to be able to do it. I see Bank Nadia and I see Rio in the aspect of ANC. They did well. As far as the percentage is concerned, they're having 60 and the other person is having 57. But when it comes to our aspect of other activities, we see red. It means that we're still what? We're still not improving. So I'm appealing to us that are here, after all this, after all has been said and done, where do we move from here? I think we need to move to the next stage of what? Taking action. Thank you.
Thank you very much. I want to make a contribution with regards to what has been achieved by the state government in terms of the fight against malaria and some of the challenges also that persist. As at last quarter, while we have been discussing issues along challenges, there is, of course, a very big success story from Plateau in regards to malaria. On that, today, that was done across the country, it had the highest reduction in the burden of malaria among the 5 children. And this reduction is not a simple reduction. It's a very, very dramatic reduction from 80.8% as at the last time it was done in 2021, and now it's done in 2025, repeated in 2025, and it has dropped to 2.8%. That is a massive drop. So Plateau State is on the map now, globally, with regards to the malaria elimination efforts, because global partners, country-level partners, National Malaria Elimination Program, they are thinking of coming. Some of them have even started coming to see what is Plateau doing right with regards to malaria elimination in the state. So we commend the state government for that, and all the partners who are working in the malaria space, of course, with all the staff. So nonetheless, we have the issue of, we analyzed the trend with regards to, you see fever among children is dropping, malaria cases are dropping, malaria deaths are dropping. From 2020 to 2021, there was up to the number of children that die of malaria every year. And till now, it has been that low yearly from the state. But we are seeing a paradox with regards to the reporting of severe malaria. So severe malaria data is just increasing based on reporting. But based on the realities, every other indices are dropping. So why do we have elevated severe malaria reporting? Some say it is because of the fact that we have to justify the severe malaria medications that we are using across the health facilities. Some, and these are matters that you make sure Thank you.
Thank you very much, sir. Please, a round of applause for him. So after she speaks, we'll take the last two comments so that we can wrap up this session.
Thank you very much. Let me start. So I think I kind of summarized the issues raised during the presentation from the LGS and the scorecard into two broad categories. First, there are issues regarding data reporting. Secondly, there are issues regarding misconduct in various forms. So when it comes to misconduct, that's where you have issues providers overcharging their the strange one is when people take deliveries and they don't remit the money. And it takes at least hours, maybe the them dilated before she comes. Minutes you are done, but deliveries take time, and I'm not sure it's one person that is in the delivery room catching the baby, carrying the cord clamp at the same time, and getting it. There is connivance somewhere. So I think that's one kind of misconduct. The other type has to do with attitude of the providers that discourage people from even wanting to come and use the facility. When providers don't show empathy. That's the second category under the misconduct. Then the third one has to do with absenteeism. When providers, like people have said, you applied, you were recruited, and then instead of coming 5 times a week, you come 2 times or 3 times. Even the 2 or 3 times, if you're expected to stay 8 hours each time, you stay 4 hours and leave. That's absenteeism. So unfortunately, I really don't see anything changing between now and the next quarter. If we want to continue postponing or procrastinating that we want to sanction, if there is nobody to serve as an example, it will just continue. And like my brother there said, if we pass this battle down to the next generation, then it will continue indefinitely. Sanction does not necessarily mean you cut people's salaries. You just have a place, maybe in the local government's headquarters or at the State Ministry of Health, compile these names and just publish it. That's enough to start with. Facilities that don't report, private facilities, before the highest sanction is that you don't renew their license. But you know Nigeria, well, Nigerians say, even if you don't renew license, they will continue to work. So it's easier, publish their names quarter by quarter. Private facilities that fail to report, publish it in a place where people will see, local government by local government, publish it at the headquarters of that. That's just an idea. We can think of effective ways of enforcing what we want. So otherwise they will not report. I'm already talking about the issue of reporting. So if you don't sanction providers that will not show up, providers that collect money and will not, they will just continue because they feel like they are eating their cake and having it. So we need to enforce what we want so that we can stop it. Then when it comes to issue of reporting, I started talking about that for private facilities. If you don't report consistently 3 quarters in a year, then your license should not be renewed. I see it's not enough to say we will not renew your license. We need to make that public. People should know that this particular private facility, their license is not renewed and they are not allowed to operate. If you don't renew license and you keep quiet, how will the ordinary citizen know that this facility's license has not been renewed and they are not permitted legally to operate? You have to publish it, put it in the news or somewhere. If there is a Plateau State newspaper, just paste, 1 page is enough. Next quarter, come and check whether people will sit up or not. Then HMIS officers, I hear that we recruited and deployed to LGAs. But you know, the data is not collected at LGA. The data is actually collected at the facility. So there is the burden of, I provide services. Let's say I'm a nurse or a tube. I resumed in the morning. I'm seeing patients the whole day. Maybe I have to close by 4 p.m. because I also need to rest so that I can come back tomorrow. How do I report everything that happened today? So what you see is that most times these healthcare providers, they pipe this thing up with the intention of then coming back to the registers to count and record before the LGA meeting, which is once in a month. Most times they are too busy and choked. They can't do it properly. So if you know what the register looks like, the immunization register, for example, you now want to do recording for the entire month. You have immunization, you have ANC, you have OPD. You now want to do all of that, like it won't work. So the best thing is good. I commend us for having HMIS officers at the local government level, but it's better. The best thing is to have HMIS officers in each facility. If you cannot do per facility, we can map facilities and have maybe one HMIS officer to work on maybe like 4 facilities. So that's the only thing that person is not, he or she's not seeing patients. The only work is to compile this data facility by facility and make sure that the correct data is entered. And I think we can start especially with BHCPF facilities. Those ones have more access to resources, and so it shouldn't happen. We should also leverage on our health fellows. Health fellows, I hope you are listening, please don't wait until, since the state has already introduced you to the local government, all the PHCs are your jurisdiction. Go in there, introduce yourself to the in charge and offer to help and support. I know what I'm saying. You are fellows, you get paid for being a fellow. So you are not paid to be a fellow to sit inside classroom. You are paid to be a fellow to be on the field. I hope you are getting it. So don't wait until somebody takes you to the facility and say, this is our fellow for this local government. No. Go into the facility, carry your letter of introduction, introduce yourself, and tell them, I am offering to support you in this particular way. That will also help. We need to relieve in charges of this data, what is it now? So it's very important. We need to get down to having HMIS officers that can also cover facilities. I think there's one more thing I want to say, but now the ranker scorecard at the last M&E, National M&E TWG, we said we don't want to refer to it as ranker scorecard again. Yes, because beyond ranker indicators, we also use it to report in other indicators. In fact, now we're including things on NCDs. We've been asked to include things around all this NCDC work about disease prevention and control.
So we have agreed that it will now be called health sector scorecard. Just giving it that name will help us. I'm trying to, there's one more thing I think I kind of maybe missed, but I'm sure later we will also still talk about it. I don't know why somebody will collect laptop for working and you're not doing the official work but using the laptop for the, yes, this one with regards to production of data collection tools, I will suggest that we reach out to the Federal Ministry of Health. I know that there is a revised set of tools that they want to roll out. So I know there is a validation meeting happening on a meeting tomorrow and next tomorrow. And after that, they are going to print seed copies of a new version of the NHMIS tools. It will not be nice if the state will invest in printing old tools and then the new tools now arrive. It's a lot of money. So let's make sure that if we're sure of when that one will come, it's better to wait and get the new version and then we make arrangements to print those ones. So yes, I remember now. The last thing about reporting. So you see those facilities that are not functional, I think you better give them a color code on your scorecard. There's no need leaving it empty. You are not expecting anything from a facility that is closed down because of insecurity or because they don't have staff. If it's not functional, give it a color code that is not red, green, or yellow. Let's know that these ones, they continue appearing on the DHIS too, although they are not functional. So if you are sending these reports of whatever you do now, I would suggest sending a report of this meeting to the DPRS in Abuja. Let them see that you see, it's easy. They see it at a glance that there are facilities that are not functioning, that are still on DHIS2, and one of your recommendations should be that they should be expunged from the platform. Otherwise, they will continue to mess up your state data. So let me stop here. Thank you very much.
Thank you very much, ma'am. Okay, so for the two hands, please try to make your comments brief so that we can close this session.
Good afternoon once again. My name is Captain Zaro, representing Bantan South Local Government of Plateau State. I want to sincerely appreciate our mother, the last speaker. She made an important point, which initially I want to speak on it, because data collection is not done in the local government. It's a PS. During one of my visitations to a PSC, I discovered that the recorder was completely absent. And speaking with the OIC, she also is complaining about the recorder. So I want to suggest that OIC should be tasked to ensure strict supervision on the virus in the within facility. On issue of ANC. In another visitation, I discovered that a complete basic facility with a good number of people within that community, and there were only but 5 who attended ANC as of March. 5 persons, only 5 persons. And so I think that this is a poor community engagement. So I recommend that various OICs in all facilities go back to their facility at maybe quarterly or either twice in a year, or maybe once in a year, have community engagement, telling communities about services and how they can partner, ensuring that we have the universal health coverage. Thank you.
Thank you very much.
Thank you so much. I'm Peter Ezekiel. I work with TV Network Nigeria and the State Program Supervisor for the Global Fund ATM Integrated Program. It's a grant. So I would like to appreciate you for this opportunity and also to appreciate everyone that has spoken. So I will point straight to what the honorable member of the State House of Assembly said about now done, and we're supposed to start seeing it reflecting in the outcome while we check the impact in the later time. However, something is actually bothering because as part of what we do, we visit facilities to see how we connect facilities to their host communities, and having the idea of mobilization of local resources to address some of the little gaps in health service delivery. And one of our most pragmatic approach is to see that more volunteers from the communities to support the health systems of the states. We know that, I don't know how correct I could be, that for over 10 years before now, there was no recruitment done. And these facilities have been held and managed mostly by volunteers. But the recent recruitment actually time mobilization of lists from all the facilities, very, very little engaged. And our verification showed that some of the volunteers have already started getting angry and leaving the facilities. So what does this spell out for us in the future? Because people try to engage these facilities for two reasons. One, for possibilities of employment, and also to learn. And the majority of them came in necessary certificates so that they can be qualified for engagement. And we pushed. We made a lot of advocacy to see that these, at least, good numbers of them were engaged. So many of them were not taken. And some talk with people from the outside community who never volunteered and supported. And another thing again is these volunteers engaged, you engaged, they were taken to other communities. Meanwhile, still leaving the existing facilities where their effort lacking this same manpower. So mine is a plea that if the next recruitment happens, I don't know, I know recruitment has a lot of interest, but we should consider these people that gave their blood, their sweat, and their tears to hold these facilities while the government is struggling with resources to engage new staff. And another thing I want to point out, the fact that most of the primary healthcare facilities, not just, I think, across the state, most of the are mainly for pregnant women, which is the ANC. We've been to some of those facilities and test kits for the general population. And the question that keeps on creeping into my mind is that who impregnates these pregnant women? Are they not the general population? So if they don't know their status, then making somebody pregnant in that process, they are also infecting them. And these children that these people will give birth to will still come and face the same general public that we are not providing test kits to take care of. So if we check, the cycle will continue to go round. So my plea here to the state government is that prioritize funding for buying HIV test kits, because we can't keep relying on the international donors to keep on salvage these important areas of our health system. And if we don't do this, I am afraid the next time there will be a massive test of the public, we will have problems. And I think I will stop here for the sake of time.
Thank you very much. Thank you very much.
Yeah, so thank you very much. Let me just clarify a few things. I know all of us clapped when he was talking of this recruitment thing. The reality is that, thank God, Monsat is here. He knows how we started it. About 1,700, Monsat, please confirm, volunteers in the entire state, as at the time we did our mapping. Out of that number, only about 500 have the qualification to be employed. You see, sometimes we sit down and think that people are not doing the right thing. It is us that cost some of the money. Many of our directors that are here can confirm this to me. Some of our siblings, some are our sisters, our brothers, our relations. They read BSc chemistry, BSc microbiology, they read whatever, and we employ them as volunteers. Some of them environmental health, and we are paying them as volunteers. Meanwhile, the people we are recruiting are J2, lab technicians, and all of that, nurses, midwives, and they don't have the qualification. And they will be crying that they have been volunteering for 10, 20 years, and yet they are not considered for employment. I can confirm to you, of that 500 that are confirmed to be health workers, not less than 400. Mozart, am I correct? Am I correct? Not less than 400 were employed. Those that were not employed were for some few reasons. One, many of them did not apply. And the recruitment process was such that you must apply, because it is a World Bank program. It wasn't within the confine of what was going on. Even at that, by the time we finished the first recruitment, the primary healthcare board still considered many of them that were volunteers that were not engaged. Some of you here brought names of some of them, and they were still considered. So that also now increased the number. So please, let's not think that the state government did not do anything about the volunteers in the facilities. They were considered, but many of them were not qualified. That was what happened. Two, you mentioned test kits. I can confirm to you, for the first time in the history of Plateau State, 2025, His Excellency approved purchase of test kits of the tune of not less than 80 million. It came through PLACA and it came through the Ministry of Health. SASCAP is here, she can confirm that. And it was a step forward, because this year we are hoping that it will increase. So we are not unmindful of the fact that the state needs to take ownership of purchasing test kits. We know, and we are working on it. So please don't think that we are not, doing anything. The state is doing a lot in that direction. So I said I should clarify that so that we don't go with wrong impression. Thank you.
Thank you very much, sir. Okay.
Thank you very much. Good afternoon, all. I'm Mrs. Agnes Nadabo Wamin, the head of Medical Inspectorate Unit. So you all bear me witness that the Chairman Committee on Health was really harsh with our activities as medical inspectorate. So I have these reasons to give. Number one is that most time there's always workshops that are being organized for the private, but we that were working in the inspectorate unit will not be involved. So we cannot do any magic to know what is really happening. So I think if you want to forge ahead, I would advise that in any time, if there is any workshop that will be going on for the private, at least the inspectorate unit should be part of it, and that will go a long way to solve that problem. And also, we also want to have the list of those facilities, because we have all their lists, and then we have a platform so that all the private owners, most of them that are registered with us, that we have a platform for them. And I feel if the list of those people that the officer that is in charge of the data felt that they don't usually give their reports, she can submit those lists to us, and then we will know a way of contacting them. And I think by so doing, we'll be able to solve this problem of data that the privates are not submitting. And also, there are these privates also that are ready to give their own data. They will be asking, how do they give their data? But on several occasions, I've been talking with the officer in charge of the data. She will now say, since some of the private are not giving their data, she will not add them to the DHIS2. So those are some of the things that is really making the private not to give their report. So whenever you are organizing any program, you should make sure you involve the inspectorate in it, so that at least we'll have a collaboration on seeing how to meet up with getting report from the private. Thank you.
Thank you very much, ma'am.
The Honorable Commissioner of Health and other distinguished personalities, good afternoon. During the local government presentation earlier, I heard that some local government areas were complaining of high cost of drugs, while for others that was not the case. So I would want to know because I know that the DMA was established to handle and bring the cost of drugs to affordable levels for our citizens. So those local governments that are reporting high cost of drugs, I would like to know their source of drugs and why they have those issues so that we can attend to them. Thank you.
Thank you very much, ma'am. All right, so because our time is fast spent, so we'll have like a working tea break so that we can catch up with our activities. So the Secretariat will just guide you accordingly. Thank you.
In addition to what pharmacist actually said, during the presentation of the first presenter, she made mention about wrong administration of drugs. And remember, this is very suicidal. She didn't give us a breakdown of whether it's the state-employed health worker facility or are they the volunteer? Where are the facilities? Then after that, what is the action that she has taken? Is the inspectorate unit aware that somebody is taking a wrong prescription to a patient? And if a social media, I remember the director of Drugs Management Agency, he said the era of substandard drugs and wrong prescription is over. Are they aware of all this thing that is happening? If not, please, we are here for one voice, one plan. So we are going to take a decision here so that all the local governments should be aware that these facilities in this local government, this is the quackery that they are doing. Thank you.
Thank you very much. Thank you. Okay, so the LGA directors, we have some of the directors here. And regarding the templates, now why their conversations were not carried along in a standardized template was because this is the first time they are conducting their LGA performance. Now, for the longest time when we conduct LGA performance, it has always been state performance, it has always been the M&E officers that attend. So we bring them on board, we have our conversations with them. However, looking at our data, looking at our reporting, we saw that we are not moving. And that was why we decided to change the stakeholders. So for the director PHCs, this is the first time they are participating in our performance dialogue. Am I speaking the correct thing? Yes. Thank you. Yes. And then secondly, based on the performance dialogue held at the national, it was resolved also that the state should go and start conducting its own LGA performance review. At the state, in our own Q4, we also agreed on conducting our LGA performance review. And that was when the communication was sent to the director PHCs. And I think that the director PHCs, they all deserve a round of applause because out of 17 local governments, 16 have successfully conducted their own LGA performance. We're not clapping for them. So this is also showing that the LGA are willing to cooperate with the state, and we're also willing to cooperate with the federal. Now, we do hope that from this engagement, our director PHCs would have a clear understanding on the expectation when it comes to performance dialogue. We look at scorecards. we don't just go and talk about our various problems. We look at our scorecard. What is data? Remember, we said we're doing evidence-based. So what is happening at the LGA, we look at that scorecard and then we come up with actionable plans. Because when we look at the data that was presented, or the report that was presented, we see that everybody is talking about challenges, no infrastructure, no fencing, no this, no that. What are our quick next steps? I was privileged to participate in the performance review in Jos South, and we talked about financial leakages. And that is why we are happy that the Ministry of Finance is here, because one thing that we know, they'll say we are technical people. Everybody is technical in their own field. So when we are talking about health, we are technical in health. But when we talk about blocking leakages, finance will better advise us. When you talk about raising our memo, quoting our budget, will better advise. So everybody is technical in our own field, and we believe that finance will also help us to see how we can block these leakages. I also gave them an example when I participated. Going to a facility, you see that in a month they have malaria cases of over 1,200 treated. And then when you talk about, for me, I was also a patient. For my stay in that PHC, I paid a total of maybe 7,000, and this was on a weekend. In a month, we did the calculation. In a year, only treatment of malaria case will generate at least 10 million naira. Now, assuming they are charging 7,000 per each malaria case that comes in, per one facility, we have 207 BACPF facilities, for example. Are we looking at the resources that is being leaked? And we are not tracking these things. These are money that we are losing on a daily basis. So these are conversations that we need to have so that we can manage these leakages and then better use these resources that we are raising or generating to improve health services in the states. Everything will say government should do this, but with the little we are generating, we can start doing some things. If roof is leaking, we can start doing some things. And then we also have the BACPF that comes as an additional resource. So some of all these conversations are things that we believe that when we start addressing, it will better improve our health systems. And then also regarding all the various activities, for example, the mentioning of misconduct of healthcare workers, all these things are things that we can manage at the LGA level. Like when I saw some of the recommendations, I was curious. We did not put our quick next steps. Okay, there's this, there's that. What do we want to do immediately? How do we want to address those things immediately? And then we put a timeline. Are we going to do this in the next 1 month, in the next 2 months, in the next quarter, biannually, or annually? How are we checking these things? It is very important that we do not just put action plans without making them time-bound. Otherwise, by the time we are coming to review again, we'll be singing the same song. Then for the LGA for the state scorecard review, I was able to quickly take some comparisons. For example, when we're talking about ANC, in Q4, we had a state average of 30, and then in Q1, we're having an average of 35. So it means that we moved. For IPT2, we dipped because we had an average of 125, but Q1 of 2026 is showing 85. So it means that we either did not have more women coming to the facility, and that is why that particular indicator dropped, or what's happened there we need to know. Then for SBA, now this SBA has really been an issue, and we have been talking about it. The challenge is, which we identified, and the HMIS officer also mentioned, most of them don't know what an SBA is. So when they come to analyzing this data, they would put the number of delivery. You see, to keep changing. The number of staff that is there is the same, it's constant. But when they want to record deliveries taken by those staff, the number starts fluctuating across the facilities. When we had the training in the Department of Planning, we asked that question, and that was where we realized that there was a knowledge gap. they didn't know what the SBA was. So different people were reporting different things. However, we would use this opportunity to also appeal to our director of PHCs that a standardization of that conversation be held. If across board all the HMIS officers know what the SBA is and the number of deliveries equal to the number of SBAs, then we would not be having these differences. Because based on this difference, it's showing that nothing has changed even with the recruitment. That is what this data is showing us. Nothing has changed. But it's just because they do not know how to capture this data correctly. Then we look at the postnatal care. There was a slight drop from 45 in Q4 to 43. Family planning remained the same, both in Q4 to Q1 of 2026. Then for ORS, zinc, and diarrhea administration management, we have the same, 94. Amoxil dispersible, we see that there is a slight increase from 90 to 95. And then percentage with children with fever, there's also a slight increase from 2.4 to 2.5. Birth registration has also increased from 14 to 16. And it goes on. So we have some indicators, we are seeing some improvements. Some indicators, we are seeing no improvement, or there's rather a reduction. And so it will be good for us to be able to look at this. So for the LGAs, please, our next, moving forward, we just want to see, based on the scorecard, are we improving, or are we improving, are we the same, or are we going down? So the experience of this performance review should translate to what is being done also at the LGA, so that we will have better reports. On this note, I think we have very much dealt with the scorecard at the state level, and we believe that with conversations that we keep having with other line ministries, we'll be able to better improve service delivery in Plateau State. Thank you very much.
Please, a round of applause to Dr. Morina for handling that session well. We are having a walking tea break or coffee break, and so we will move to the next item on the agenda, which is going to be a Q1 AOP performance review, and the person responsible will be the DHPRS, State Ministry of Health. Please put your hands together for the director. Wow. Don't worry, we'll invite them to cover the meal for you first. Okay. Please put up the slides. That is with you people. Okay. It will be better captured, so let's just allow the media to put up the slide. Right. Help us put up the lights once more.
It's like the first project on the left. Yeah.
The Honorable Commissioner, sir, in the person of Dr. Nicholas Bamlon, the permanent secretaries that are here, Dr. from Ministry of Health, you're welcome. Director of Health Planning Research and Statistics, directors from the LGAs, program officers. Good afternoon, all. We are going to look at our performance for the last quarter. That's quarter one and 2026, year 2026. So I want us to please look at it and see where we were and where we are now and what we have been able to do. Plateau State Health Sector 2026 quarter one annual operational plan performance. Next slide. If we look at the first slide here, we planned 316 activities for quarter one. 5% of these activities were funded. 4% were fully implemented, and 1% of the activities received funding but were not completed within quarter one. And this results in the overall rate was 4%, meaning only 4% of our activities planned were executed. So when we look at the table, though it's a bit tiny, I don't know whether you can expand it. And we look at the table, it's the same thing that is there, but in a tabular form. So when we look at it, we see that our implementation status, total number of health sectors, HSSP activities planned were 316, activities funded were 5, and then activities fully implemented were 4. And 1 activity was not fully implemented in the last quarter. Next. Why were these activities not implemented? We'll look at the constraints. What causes it? The leading constraint affecting the implementation of the activities was activities memos not well defined. There are some memos that were not well defined, about 84% of them. Others were memos not approved, or they were delayed or denied. I think during the last performance dialogue, we mentioned a memo that was raised, and then the memo got missing in transit. So it's among the 11% memos that were denied or delayed. Memo approved, but no cash backing. There were some memos that were approved, but there was no releases. So this amounted to 0.6%, and execution yet to commence was 0%. It's captured on the table. Next. Annual operational plan activities by funding sources. Of the activities reviewed, that is for the last quarter, 223 activities were planned to be funded by government budgets, with only 6 funded and 5 completed. 223 activities were planned, and then only 6 were funded and 5 were completed. Activities were planned to be funded
funded, activities that were planned to be funded by partners was just one. And then one was funded and one was completed, giving us a rate of 3.3%. Activities were planned to be funded jointly because these activities were planned in three categories. Those that were planned to be funded by government, and those that were planned to be funded by partners, and then those that were planned to be funded jointly. So those planned to be funded jointly for the last quarter were 2, and 2 were funded, and the 2 were completed. So we have 100% of that. Next. Annual operational plan budget amounts spent and performance by funding sources. The total cost of the Plateau State 2026 AOP amounted to, that's for the first quarter, amounted to 26 billion 286 million 792,768 naira, of which only 5 billion 735 million 831,655 naira 67 kobo was planned for Q1 activities. For the period under review, we could see that it's only 5 billion was budgeted for government funding, while for partners funding, we did not allocate funds. And for joint funding, we could see that the joint funding too, we did not allocate funds. For the period under review, a total of 5 billion was shared across all funding sources. Government funding, from the 5 billion, government were able to spend 118 million from 5 billion. Government were able to spend 118 million 437,625 naira. Development partners supported, recorded a spending, though we did not allocate funds to development partners, but they supported activities, and this amounted to 41 million 8,500 naira, while joint funding recorded a spending of 2,725,000 naira. Next. Government budget funding recorded a performance of 73%. If we remember the slide that I just presented, with 118 million spent out of 5 billion budgeted. Development partner support showed a performance of 25.3%, reflecting an expenditure of 41,008,500 naira against a budget that was 0. Similarly, joint funding achieved a performance of 1.7%, with 2,725,000 spent against a budget of 0. Next. No, there's another slide. Okay. Government budget funding recorded a performance of 73%, with 118,473,625 naira spent out of 5 billion budgeted. Development partner support showed a performance of 25.3%, reflecting an expenditure of 41 million against a budget that was zero. Similarly, joint funding achieved a performance of 1.67% with 2,725,000 naira spent against a budget that was zero. I want to say thank you. Dugode, Mofen Piak, Plandes, Palamfuet. Thank you very much.
And that was a presentation done by Victoria M. Pam, the DHPRS State Ministry of Health. Please put your hands together for them if your hands are not too busy. It is not easy having all these put together. It's not a day job, and that's why we've been called upon to always update our own records. I think we'll quickly move to the next session. We will be skipping number 9 item. We will be moving to the 10th item, where we will be having the MAMI update. To start with, I will invite the director. Okay, sorry. All right, thank you. So as I was saying, I will be inviting from Just East for an update or a presentation on MAMI program. Please put your hands together for our auntie that is coming up. Sister.
Good afternoon, all. Permit me to stand on the already laid out protocols. I am the director of PSC, Just East Local Government. And Just East Local Government is one of the local governments that have been selected for MAMI projects. And MAMI is a maternal and newborn maternity innovative initiative. Next slide. Outline. We have introduction, MAMI intervention activities, monitoring and evaluation indicators, summary and conclusion. Next slide. Here is the background of Just East Local Government. Just East has a total of 145,845 as target population. And Just East has a number of 19 wards. Out of the 19 wards, we have 10 that are selected as basic healthcare provision fund facilities. And this MAMI project is centered on the 10 facilities that are basic healthcare provision fund facilities. Just East, we have one secondary facility, that is the General Hospital Angware. Women of childbearing age, we have about 31% out of the total population. It's supposed to be 31%. Their occupation, most of them are farmers and miners. Number of emergency transport, we have about 50 because we have 5 per facility and we have 10 facilities that are working with MAMI. So 5 from each facility made up 50. Number of triagers, people that are linked between the community and the facilities, we have 10 of them because each of the facility has one. So the work of these triagers, they are the ones that connect the community, our clients, with our transporters. That is the dispatchers. Number of women transported from 2025, that is Q4, to 2026, Q1, and part of Q2. We have so far transported about 488 women from their homes to the facilities for deliveries and other cases. Next slide. Miami intervention and activities. Number 1, these are some of the activities that we did when we started. We started with advocacy on the need to identify maternal health issues, complications, and seek prompt care at the health facilities. We paid advocacy to the traditional council through the Aja Anaguta of Anaguta and his cabinet in his office. And advocacy was paid to the local government chairman and his council members. We also paid advocacy to faith-based organizations. Advocacy was also given to the women group. Our ANC sessions in all the facilities in Jos East, we had advocacies. Then during immunization sessions too, sensitizations were ongoing. Next slide. Sensitization and training. This is part of the activities that we did. Officers in charges of the 10 basic healthcare facilities were sensitized and also trained. We also trained our transporters, the 50 I talked about, and their community triagers, the 10, by placemsas. Community and facility utilization of maternal newborn health drugs by the National Primary Healthcare Development Agency was also done. They were taught on how to receive these commodities, how to utilize, and also report. Next slide, please. Miami intervention and activities. Distribution was ongoing. This is when they went around the 10 facilities to distribute those maternal and newborn health drugs to the 10 facilities. They were delivered by the Primary Healthcare Board and the National Primary Healthcare Development Agency. Next slide. Monitoring and evaluation indicators. This is some of the indicators that we are able to monitor and evaluate. Number 1, we were able to monitor deliveries versus delivery by skilled birth attendants. Number 2, we are able to monitor first visits versus IPT3 uptake. We are also able to monitor ANC fourth visit versus IPT or less than 4 IPT. Then deaths of women related to pregnancies. We also monitor postnatal care clinic visits. Next slide. Here are the reports of our monitoring and evaluation. Numbers of deliveries. Deliveries conducted by skilled birth attendants and percentage of deliveries conducted by skilled birth attendants in Q4 of 2025. Then Q1 and Q2, though we have not rounded up Q2 of 2026. And the first, the blue is deliveries, general deliveries. The orange is showing deliveries by skilled birth attendants. When we look at it, based on these figures here, deliveries conducted for the whole quarter were about 508. And out of the 508, only 249 were conducted by skilled birth attendants. The reason is because there were very few skilled birth attendants during that quarter. So most of the deliveries are done in the facilities, but not by the skilled birth attendants like the midwives, nurses, community health. But other health workers within the facilities do receive the deliveries. That is why there is that gap. And it's just measuring those conducted by skilled birth attendants is 49%. When we look at the first quarter in 2026, we had a total of 422. Out of the 422, only 202 skilled birth attendants in that quarter. So it's just about 48% that were conducted by skilled birth attendants. Then when we look at the second quarter in 2026, we can look at it based on what we have entered so far. There is a little bit of improvement. The reason is because the government was able to engage more of the skilled birth attendants, and they are posted to these facilities, and they are there, and then it is trying to show to us that there is a little bit of improvement. Because of out of 121, we have about 76%, and then 76, then the percentage is 63, which shows there is a marked improvement. And I believe that subsequently, in the subsequent quarters, there is going to be marked improvement in deliveries by skilled birth attendants in the facilities. Next slide. This is ANC first visit and fourth visit versus IPT1 and IPT4 in quarter 4 of 2025 and also in quarter 1 and 2 of 2026. Looking at quarter 4, we can see the reverse is now the case. The visits of the antenatal is high. Reason is obvious because of sensitization that was ongoing. We did a lot of sensitization even during our antenatal visits, during our immunization sessions, and then advocacies that we are paid to those people, key stakeholders in the communities, make the people to come out in mass for registration of antenatal. Then the orange is talking about IPT1. In the registration of ANC, we encourage early booking. In the early booking, some of them, they do come before the 16th and the 20 weeks, so they cannot be given IPT1. That is why the IPT is 625 compared with the number of the pregnant women that visit the facilities. Then the IPT4, it was also low. And then within that period, we had a gap of SP. There was out of stock of SP in some of the facilities. Very few had SP adequately to give to the pregnant women, coupled with those that were not able to reach those that booked early. So we had a gap of a shortage of SP during that quarter 4, and it was reported even to the states. Then when we compare the data in quarter 1 of 2026, we will see that there is a much improvement compared to the fourth quarter. The IPT uptake, out of 819, 627 were able to take IPT1. IPT2 and 3, though still not encouraging, but then we have tried to find out what really happened. The same complaint goes back to shortage of IPT. Then when we look at quarter 2 that is still on, we can see that there is marked improvement in both the ANCs and the uptake of the IPTs. Next slide. Number of postnatal clinic visits versus deliveries conducted in quarter 4 of 2025 quarter 1 and 2 of 2026. When we look at these indices, you will see that there is a reverse. In the postnatal checkup, the postnatal visits to the clinics, we can see that it's higher than the deliveries. The blue is postnatal visit clinics, and then the orange is the deliveries conducted within those periods. Why it is so is because some of the women do go to neighboring states for delivery. And reason is that when they go there, they usually give them some incentives. So they prefer to go and deliver and be given incentives, then they will come back to us for postnatal and immunization. That is why you can see the deliveries are lower than the postnatal visits in the facilities. It's because they go to neighboring state, Bauchi, like in our other sites in Rinji, they go to Toro local government. When you go to Mejuju site, they go to Plateau for deliveries. When you go to Begemu site, there is a boundary between them. They go there for deliveries because after deliveries, they usually give them some stipends, like money and other incentives. So they prefer to go there and take and come back for postnatal visits and immunization with us in the community. So it goes on and on until the second quarter. Next slides. Discussions and challenges. 1. ANC first visit uptake remains encouraging, showing continued demand for maternal health services across health facilities. Like we have seen in the data presented, the ANC uptake was encouraging. IPT coverage is declining, indicating possible service delivery or supply chain. Like I said earlier, in the fourth quarter, there was a gap of SP, which was also reported. Like I said, some of the facilities hadn't the SP to give to the women. And that is why there was a little, you can see from the data presented, the gaps. December showed peak performance across indicators, suggesting that program intensification strategies are effective when implemented. There is no report of any maternal death recorded in the LGA throughout these quarters. Thank you. Next. Recommendations. To strengthen maternal and newborn outcomes in Jos East. 1. Strengthen facility reporting compliance, especially for data quality in terms of completeness and timeliness. I think I observed that there were a little bit of gap, knowledge gap, in the side of some of the facility staff in compiling the complete reports of their facilities. And I will suggest here that if capacity building will be done, I think it will go a long way to help so that our data will be quality data, complete and timely. 2, engage community leaders and traditional birth attendants in promoting facility deliveries. We have gone round, even though within these periods, there has never been any report of community delivery. We have MCPD SR committee in the community. We've been liaising with them from time to time to give us reports of what is happening within their communities. None has ever reported that there is a delivery, community delivery. Though we called even the TPS, we start with them. Then we encourage them to keep encouraging these women to come to the facilities because the facilities are equipped with things that will be able to take care of these women. So we had that, we collaborated with them on that. Investigations. Number 3, investigate the drop in IPT uptake, including SP stock levels, and provide adherence. Like I said earlier, we had a gap that was created, a shortfall of the supply. So we complained, but glory be to God, because now we have more of the SPs available. And that is why when we see quarter 2, there is an improvement in the uptake. 4, scale up community mobilization strategies that lead to high ANC attendance in December. We will still scale up our mobilization. We will still scale up our sensitization. It is ongoing in all the facilities during our programs like ANC and then immunization. That apart, the social mobilizer and some of the LGA team normally go for an outreach to be able to synthesize areas where we see they are not doing well. They go down to give more of the advocacy and sensitization. 5, strengthen referral and emergency transport system. Like I said earlier, currently we have about 50 of our transporters in those 10 communities, 5 each. That is 15. Then also we have the community triagers that link the community with the facilities to order for transportation. We have them and they are doing well. 6, improve supportive supervision and mentorship for maternal health services. That is ongoing. We've been doing it and we'll continue to do. We need to even do regularly so that it will help us to be on track and to be able to get the correct and accurate reports. Next slide. Conclusion. Just East LGA continues to demonstrate good ANC services demand, but declining IPT coverage and inconsistent reporting undermines maternal and newborn health gains. Focus intervention in data quality and sustained community engagement will be critical moving forward. Thank you for listening.
Thank you very much. I think that presentation was very, very clear and mind-blowing too. Can we once more give her a round of applause for that? With that report, I think I will invite the representative of the National that's the National SWAP Coordinating Office. That's talking about the MAMI lead in the person of Honorable Dr. Dayo Adeyanju, who will be doing another presentation. Please put your hands together for her. Huh? Health fellows. Okay, sorry. I beg your pardon, we'll be going back to the plenary we actually skipped. The swap officer will help us handle this. Please put your hands together once more.
Good afternoon, everyone. I'm here again. So now we are going to just look at this state performance of the AOP. We saw the presentation. Please put it on the next slide. The next slide. This particular presentation, the next slide. Okay, so just a refresher, we can see that at least 316 activities were planned across the ministry, agencies, departments, programs, and out of that 316 activities, only 5% were funded, 4% were fully implemented, 1% funded but not completed, and the overall percentage for implementation is 4%. Out of 100%, so if we are scoring ourselves, we took an exam, 100%. Are we doing well? Chorus answer is accepted. Are we doing well, please? So we can see here that if we were to score ourselves out of 100, we got 5 out of 100 for quarter 1. And this is really not encouraging. Now, please let's go to the next slide. %84 memos were not raised. Comments. Please step on my. Okay.
The Honorable Commissioner, the representative from the SWAP office, directors, I am tempted to ask the question in respect of the memo. If memos were not charge who is supposed to raise memo, or the Honorable Commissioner who is supposed to sign. But I think is the person that is supposed to raise a memo, because the ministry, no memo has never been signed. I mean, no memo has ever been raised and not signed. Concerning memos generally, I was waiting to make a comment. There was the use of memos denied, memo delayed, and memo got missing in the ministry. I think such words have a negative connotation, and it has an effect on the personality of the ministry. When you say memo were denied, I find it very difficult to understand that language. When you say memo were delayed, now sometimes the use of words matters a lot. When you use the appropriate words, it can cushion so many things. Like memos got missing from the ministry. To the best of my knowledge, I don't know for the commissioner, but for me, I don't know any memo that was. If there was a memo that got missing, I think probably we should have been informed. 1, 2, memos have been approved. Approval of memo is one thing, release of one thing. But we are so privileged to have a governor in the state that all approvals are always backed with releases. Yes, it might not come as when due, but releases, there will be releases. And so if there was an approval that was done, we are expecting releases, not that releases were being denied. Thank you.
Thank you very much, sir.
Yes, so just to add on what the council has said, I don't want to emphasize what he has already mentioned. But the truth is that even the federal government of Nigeria, if you remember towards the end of last year or early this year, the Minister of Health had a press conference where he confessed that only 60 million of the entire budget of 2025 was released to the ministry. 60 million. Most, if not 99% of what is going on in health are by our partners, development partners. We need to appreciate them and we need to clap for them. Our partners are the ones that are funding health. If the states, as we are reflecting here, I'm sure what Malaria Consortium has put into the states this year, what APIN has put into the states this year, what WHO has put into the states this year, our budget will not be as poor as this. I'm sure we are not getting those data. We are not reflecting them. Beyond that, the governor himself has been very, very magnanimous to the Ministry of Health. But you see, we cannot expect that any memo you write, it must be approved. There are memos that you weigh before you now send, because activities vary. What we expect to see in what DPRS presented, even those ones that are released, where is it coming from? Which of the agency? Which agency actually wrote a memo and it was approved? Which one was released? Because I know we have even approved memos in the State Executive Council for health to the tune of over 400 million last month. These were memos written by Hospitals Management Board and the DMA. Did we reflect some of those? I don't think so. Because maybe we didn't contact the agencies. Releases may not have happened, yes. But memos were approved. And I can assure you that it's a matter of time. I was talking to the PAMSEC. There are so many compounding issues that requires money across the ministries. But we have been very lucky. Most of our memos, when it goes, it will delay the release, but approval, most times it will come. Why? Because before we write a major memo, we'll discuss it with the governor. And the governor is always willing, once he's convinced on what we are doing. So I think we should also appreciate His Excellency. Yes. So some of the figures I saw, for instance, I saw where you mentioned 70-something% for out of 118 million, out of 5 billion, and you say 73%. I don't know how the calculation was done, because from my calculation, 118 million of 5 billion is 2.4%, or thereabout. So I am a bit worried that I'm sure the calculation, there was some mistake somewhere. And please let us capture what our agencies, what our development partners are doing. Even if we don't want to get their entire budget, but their activity that they have done for us in the state, if we capture them, the health budget will be improved. Thank you.
Thank you very much, sir.
Thank you very much for the observation and the corrections. I want to inform us that performance tracker was sent to program officers, to agencies, for them to track their activities and their implementation status with all the funds, releases, memos raised. A performance tracker was sent. So from that performance tracker is what we gathered. We received those information from the performance tracker and we harmonize it. It's for the whole health sector. It's not just for one parastatal or one agency. We want to assure you that it's what they submitted that we now collate, and then we brought it up so that we can look at it, discuss, see where there's mistakes, see where there are corrections, see where we can improve. That is why we decided to bring it up the way they submitted it, sir. Thank you.
Thank you very much, Ma. Any other inputs? The agencies. Did we capture all that you did from the agencies?
Thank you. Director, ma'am. Thank you for making that clarification. Yes, I understand that. A lot of times we do that. We do that. Even for the national job, we do that. We send templates to the states and tell them to populate it and return. But I think at the state level, it would be nice before we bring this to an open or public meeting like this, to have a meeting with all those program officers, all the people submitting, so that we can actually ask questions and clarify whatever needs to be clarified. So that if we are coming, like now, the press, they are here. It goes on NTA, it's on YouTube, everywhere. We're hearing that in Plateau State, memos are missing. So that might not be the true story. It might be. It would have been nice. Let's have that meeting, maybe even if it's like a week before this one, so that all those kind of things can be trashed. We understand it. We all agree on how it should be presented, such that we're not also, not that we want to mask the truth, but I think we present it in a way that everyone will understand. Tomorrow, if you see people carrying placards and saying all our memos are missing or we are not approved, it is because of the way it is presented. And I'll follow that up with the question. So now, the reality is that what we plan and budgeted for, we're not receiving the funds to actually carry out these activities. So how do we navigate? Because the year is running out. We set targets that we want to meet. So what alternatives are we trying to explore? How do we as a state plan or intend to navigate this season? I'm not sure it's only in Plateau State. Or have you learned something from other states? It's happening, I think, even at the federal, like it was in the news, the whole world heard it when the minister said it. It's not only him, even other sectors as well. What's the plan? How do we navigate this? Thank you.
Thank you very much. So we'll get to answer what our plan is, hopefully before the end of this meeting. A representative from the head of agency. Agency.
All right. Thank you for the opportunity to make comment. The Honorable Commissioner of Health, the Permanent Secretary. Let me rely on the established protocol. For us in hospital management, I think that what the governor is doing is highly commendable. And just as the commissioner rightly stated, for the first quarter of the truth, we wrote a lot of memos, and we had a few of them approved, and some few are waiting release. Like you rightly say, some of the major memos we wrote and are approved, and I think we are at the verge of receiving the release somehow. Just to say that I was sitting and I was actually trying to say that for the first quarter, we all know the challenges that are associated with the first quarter. And we do know, and we are very hopeful, based on what we have seen that His Excellency has been doing, that the performance for the second quarter will be significantly different from what we see in the first quarter. So I want to assure you from the national office that our governor is doing excellently well, and we can say in the pipeline there is more than enough that he has put in place, and you are going to be excited the next time you are here as we have this meeting. Thank you.
Thank you very much. So, for primary healthcare board, for example, because I know that primary healthcare board comprises of at least 60% of this AOP. Does this reflect what the primary healthcare board is doing? Okay, it's like the director stepped out. RH, okay.
Thank you. Even though I was held up in a meeting, I was not around when you presented. Why, just as a way of summary or an update, we have written a good number of memos. I think some of the major, or one of the major memo has been approved, and it's awaiting cash backing. And I think about all in all, we've written up to 50 memos, but we've received approval from His Excellency for about 4. So we are still engaging and pushing to see that more are being approved. Thank you.
Thank you very much, sir. So, from our conversations, anybody else, please?
Yeah, thank you very much, Honorable Commissioner, the PAMSEC, and indeed all the directors who are here present. Even though I came late, but I listened to the Justice Director when she was making her presentation. And I also listened to Dr. Dayo from the Federal Ministry of Health. And it's just to say that, let me lend a voice by saying that I wish to commend the Justice for being able to showcase Plateau State very well, and for which, we are expecting some dividends. And this is what we keep saying, that at your own level, please do the best that you can. The commissioner is doing his own. The commissioner cannot, go down to the LGS to do the job, or to the settlements or the communities. But we've seen a very good example from Just East. Ours is to urge all LGAs who have responsibilities, either in the RI, in the primary health care centers and the services. They should do their best. Stretch yourself. And then I'm going to bring that home to say, when I say stretch yourself, I know what I'm saying. Because the commissioner will only look at that person who is creative. That is the truth. Yes, there's no fun, but people are also still working somewhere. You will tell me somebody is volunteering. When I listened to the commissioner when he was saying that, there was a point they were looking for people to engage. And those who claim that they were working as volunteers, they didn't have the requisite qualification. This is the truth. Now, you won't expect to take somebody who's not qualified. You have criteria. But where I want to hit at is this. I've heard people talk about funds, talk about releases. This is something we know about Nigeria. This is something we know. If the commissioner is saying that, and the minister who is supposed to be president is saying funds are not released, then what can you do at your own level, at our level? There's nothing we can do. The commissioner cannot do certain things if funds are not released, which is the truth. And this is where we have to be creative as leaders. Now, yesterday, I heard that there are some companies hanging around us that are making profits. I'm not saying income. Profits to the tune of billions, trillions. What are we doing to look at those companies, to go to them, to attract them to do what they call corporate social responsibilities? If now you say in your community, you are offering services and you do not have funds, you have very laudable services that you want to carry out. And there are these companies, in fact, example, let me give you this thing. If I call Dangote, it's a household name. I'm not advertising for him. Dangote spent alone last year made over 4.something trillion profit. Every day we buy cement. The government will buy patronize. Can you invite them? What can you do for us? 1, 2 LGAs. Can you support this? Can you support this? Because this funding, we must look for a way of solving it. If we have activities to carry out and we do not have funds, what do we do? MTN is there, almost all of us here. Every day we subscribe. Is there something we can do with them? I was just driving the other day, I saw OPay. Almost everybody has OPay account. Can we invite them? Do advocacy, talk to them. Because the truth is this, yes, I heard the commissioner mentioning partners. I'm telling you the truth. If you call up the partners to sit down with you, they will tell you they also are experiencing weekly funding. So this is the truth. We must look inward. And if somebody has, I know they use their funds, they work for it. Then we also patronize them. If somebody has 4.3 or 4.5 trillion as profit, that money needs to be plowed into something meaningful. So thank you very much.
Thank you very much. That's from WHO. That from
Now move to the 11th item, and I will be calling on the National Swap Coordinating Unit representative or coordinating representative to help us in this. So let us put our hands together for the NHSRI reforms, which will be handled as the National Health Fellows, which will be handled by the NHCO representative. Oh, you prefer to sit down? All right. Okay. Please put your hands together for her once more. Thank you.
Thank you. I feel that we'll be sitting for long, and we should all stand up and try to stretch. I'm sure the medical people in our midst will tell us that it is also not very good when we sit down in one place. We've been here since like 10 a.m. I think I got here around 9:30, and I've not really moved around except that I came out to make a good message. So let's try and move around, even if it's just to stretch and turn and take 1 or 2 steps around your table. Yes, you can just go around the table, maybe once or twice, and then don't go home. No. We have not said it's time to go, but we need to stretch. We don't want a situation in which when we say it's time to go, some people find it difficult to actually stand up. So we have 1 more minute to go to do that. Meet that colleague you have not seen since the beginning of the year. Ask somebody for his or her name, their local government, their department, the ministry. Thank you, DJ. DJ is even telling us that we should dance for 30 seconds. Some people have not moved. Some people are still sitting. And that will also help us after the tea break, so that we will remain alert and be able to concentrate. All right, thank you everyone. Can we return to our seats? Now let's return to our seats so that we can continue.
Let's return to our. In this session, we will have a brief, I'll just say a few things about the National Health Fellows, and I may call on some of them. Can the Health Fellows in Plateau State rise up, please? Except you are a fellow, please sit. Only the fellows should stand. Hello, the people.
Hello, please. Hello. Directors. Please take your seats, please.
Let only the fellows
stand.
Stand. Only the fellows should stand. We have, I think, 17 local governments in Plateau State, if I'm right. So I expect to see 17 fellows in the room. How many do we have here? Are you 17?
Yeah, 14.
14. So 3 people are not here. Yes? What?
Okay, there are 16. Okay, 1 is coming in, making 15. The 16th person may be outside.
So are you saying 16 of you came, you are present in this meeting? So what happens to the 17th person? Is that the local government with the missing data?
That's Mika.
With missing data and missing health fellow. Let's know so that we will focus all our attention on that LGA in the next 3 months. But do you know why the person is not here? Okay, I hope it's for a good cause. So can we just appreciate our fellows, and I will tell us why. Thank you. You may have your seat. So, because I have the privilege of being part of, well, I wasn't really part of the recruitment process as it were, but at least I know the process. When the Health Fellows program started last year, you know, some people thought it was fake when they saw the adverts. Some people thought it's 419, scammers. You know, when they saw the adverts that they should apply. In some local governments, you know, the interview panel consists of a traditional ruler. I think the WHO state person was the chair and all that. So in some places we had stories like this, that the traditional ruler that was supposed to represent, to be part of the interview panel, actually went there with, you know, a double mind. It may be this message is from some kidnappers, you know, that want to deceive him or her. Thank you, sir. You know, that want to deceive the traditional ruler and a member of his community to a particular place and kidnap him. So they went to actually go and check, and you don't blame them. Nigeria is a country where you really don't sleep with your 2 eyes really closed, because your closest neighbor, even your own blood, can choose to sell you if you are not careful. So they went, and to their greatest surprise, it was true. There was an interview panel. I think people even went from Abuja to all the states to participate in the interview process. And then people were also afraid of another thing. I don't know anybody. So I'm not sure, this one they invited us for interview. I am very sure they already have somebody that they want to pick, that they are going to, you know, you hear stories, people that will not even apply, that will get the appointments. So people were really afraid and skeptical.
But fortunately, history was made when a full list of 774 health fellows emerged, based 100% on merit. There was nothing like, is the commissioner's cousin or is the head of service nephew. Nothing like that. Nobody can come out and even say, I know the minister, including the fellow from the minister's local government. So they were selected. The process was rigorous and also very open, and they were selected. So we had the first cohort last year. They came to Abuja for training, and Mr. President actually did the launching. And I'm not sure I can forget that day very quickly. We were all together in the banquet hall. You know, I'm sure many of these fellows have never imagined that they even be to Abuja, not in the next 20 years. Now, they not only came to Abuja, they were there for 1 whole week. They had rigorous trainings. And, you know, of all things, they were now invited to the presidential villa, Aso Villa, at the banquet hall. And the president himself came in person to launch the first cohort of the National Health Fellows. And that was the beginning of the journey of the National Health Fellows Program. Now that same process was repeated, and again in 2026, we have another set of 774 health fellows across all the LGAs. In fact, I remember that this year, it was when we were in the hall. There's one person, a photographer who follows, you know, everywhere. No, it was last year. Just saw somebody that they grew up together, tap him from behind, saying, "What are you doing here?" No, so you, what are you also doing? He said he's one of the fellows. He came from his local government. They were so happy and excited. He knew nobody, but he got that post of merit. So that's why I said we should clap for our fellows, because they made it just on merit. Having said that, there's a popular saying that to whom much is given, much is also what expected. There are roles. We're not doing health fellows program because President promised during his campaign that he will launch a program and we will recruit people that will be health fellows for 1 year. There are expectations from the health fellows. I believe we are all listening, please. Because after this meeting, I want us to understand what fellows are expected, what is expected of them. You know, when you don't know the purpose of a thing, you underuse it or you abuse it. So if we understand what these fellows mean, we should then know how to engage them meaningfully and profitably. I've mentioned one of the things they can do. For data issues, you don't need to wait. Go with you have your letter of introduction, right? Just go to that facility, introduce yourself. If you think there is a better way, you can first go to the traditional ruler in that community. Introduce yourself. I'm the fellow representing this local government. These are the things I can do. Because fellows are not also expected to sit back and wait for classroom instructions for 1 year before they are expected to think innovatively. What are the challenges? If you meet the traditional ruler, if you meet the LGA, maybe the director of PHC or the M&E officer for the LGA, try to do some kind of needs assessment. What are the challenges in this LGA that I'm representing? Look at the data, collect the data, look at it and ask questions. And based on that, you as a person come up with some ideas of what can be done to address the issues that you see. There are some you will see it yourself. You know, the last cohort 1, when they were graduating, in fact, before they even graduated, there was one time last year we had like some kind of midterm review with the minister. And some of them logged in from various destinations, showing us the kind of things that they were doing to help their communities and their LGAs. So I'm challenging our fellows. Don't sit somewhere waiting for classroom instructions. Somebody, I know you have a mentor that's attached to you. You are not waiting for that mentor to list what you should do with 1, with 2. You have to go to your community, go to your local government, get all the necessary information. I just said you can do a needs assessment. Just do it yourself and think of what you can do to support as an individual. Thank God that honorable that came said he is ready to support you. I don't know if you have his contact, but please do well to get it. And I think you can have regular meetings among yourselves as fellows, even if it is once in a month. You don't have to travel. Thank God, one of the benefits of COVID is that we now do a lot of things using technology. Have a call, a WhatsApp call, a Zoom meeting, where you can discuss and exchange notes so that you know what is happening and what can be done. Now, to leverage on the deployment of the National Health Fellows, especially in the 172 highest burden LGAs. When I talk about 172 highest burden LGAs, I'm talking about the MAMI LGAs. To leverage on the deployment of these fellows, if you are, I can't remember the name of that, I think it's Jos East, that is a MAMI LGA. Where is the fellow from Jos East? Good. Have you ever had a meeting with anyone within that local government as a MAMI local government? You have? Who is the person you talk to? In the first place, are you aware that Jos East is a MAMI LGA?
Yes, I'm aware.
Okay, and you understand what MAMI is all about?
I do.
What the objectives are, what are the different interventions and all that. Because if you don't know, you might not know how to come in and how to support. So I'm saying that because we are hoping that we will leverage on the presence of health fellows in MAMI LGAs to ensure that MAMI actually delivers on its, its mandates, so to speak. Now, you know that the goal of MAMI, what's the goal of MAMI? What is MAMI aiming to achieve?
It aims to reduce maternal and neonatal mortality.
Yes, the aim is to reduce maternal and neonatal mortality, especially in these local government areas. And do you know why these 172 local government areas are selected?
Yes, ma'am.
Tell us.
I think
so we are both presenting this together. Tell us.
Okay, data was collected in all the LGAs, and it was discovered that these LGAs had more of the maternal and neonatal deaths. So.
Thank you. So they have the highest burden of maternal and neonatal mortality. So it will not make sense for government to invest a lot in a fellow, and the fellow is just sitting down in that local government and cannot see anything that he or she can do to support that government initiative called MAMI in that local government. So we are hoping to do that. One, we want to do, and I'm saying this so that we all understand what the fellows are expected to do. If you understand what they are expected to do, you should also understand what kind of support they require from you. A fellow cannot just walk into a PhD and say, even if the fellow is a consultant, ops and gyne doctor, I don't think the fellow will just walk in and say, okay, I'm here to help you do CS, or I'm here to do blood transfusion. They need that acceptance from their local government and the community. And don't forget, these 172 LGAs are not the only ones where women and children die. But we're saying they have higher burdens of death when it comes to maternal mortality and maternal and neonatal mortality. So that's why we're focusing on them. So one, we expect that all fellows will systematically identify gaps, challenges, and opportunities in maternal and newborn health programming at the LGA in alignment with national policies and guidelines. That is an assignment. If you don't know what national policies and guidelines are saying regarding maternal and newborn health, you will not know there is a gap. If the policy says, for example, every pregnant woman that presents herself for antenatal care should take at least 3 doses minimum of IPT before they deliver, say by is it 3rd trimester or something. If you don't know that's what the policy says, you can enter a facility where they are only giving 1 dose of IPT throughout the pregnancy, and you will think it is normal and it is acceptable. So you need to know what the policy says. You need to know what the policy says regarding newborns. You need to know what is the national guideline when we talk about accessing postnatal care. How soon should a woman access postnatal care? You need to know that. That's where you can identify the gaps and understand why people are not benefiting from these policies and interventions. That's how you can then also be able to come up with what are the opportunities that can bring about the change we want. That's the first thing. The second thing you can do is to support the strengthening of stakeholder coordination and engagement across local governments, development partners, community and community structures within your LGA. Although I'm zeroing on, I try to focus on Mami LGA, don't forget what I said. The only LGAs where mothers and neonates die are not Mami LGAs. We're saying that the ones in Mami LGAs are unacceptably high. So that means in other local governments, women and children also die. Maybe not as much as in Just East. So this same thing is applicable even, in those local governments. So you need to strengthen that coordination in the spirit of swap between the state government, the local government, development partners, and the communities. Sometimes our interventions are not driven by the immediate needs of the community. So at the state level, we're in just now, we can come up with some interventions that may not fit into the context of a particular local government perfectly. A fellow should be able to identify that and bring it to the fore, so that those in leadership positions can speak to it. Then the fellow is also expected to ensure clear, consistent, and harmonized communication between LGA level actors, state Mami focal persons, and relevant state and national stakeholders. I think that is clear. You are supposed to be the bridge between those at the state level and the local government and the community. And lastly, you are to support the coordinated implementation of Mami's minimum viable products and enabling components at the LGA level. So you are expected to actually be involved and be fully embedded in the implementation of Mami in your local government. Now, those are some of the things we expect the fellows to do. Their roles in advancing mommy in their LGAs. So even if your LGA is not one of the 172, it will be nice for us when we come back at the end of 1 year to see how you have helped to facilitate, for example, the sinking of a borehole. How you have helped to do some kind of community health education. How you have helped to do some kind of outreach to ensure that children are immunized as at when due. Those kind of things are innovations we expect to see from Mammy Fellows. Now, there are roles and duties that are targeted to improving maternal health outcomes. I'll just continue with that. I've said this, you should identify implementation gaps and coordinate timely responses with relevant stakeholders. You should manage stakeholder engagement at LGA and community levels, including collaboration with World Development Committees and other community structures. Actually, for the local government review, that data, that monthly review they do, it is compulsory for health fellows to attend. I'm not talking to the person from Just East alone. I'm talking to all of you. It is compulsory for health fellows to be a statutory member of that LGA level PHC review. Because you're supposed to bring your expertise and your knowledge in whatever field to also help. You know, there's nothing wrong with you meeting with the LGA and in person before that meeting to first look at the scorecard and see what the scorecard is saying you're pointing at. So that before the person goes for the meeting, you have already helped to identify what the issues are. You have identified which facilities contribute the most to the red colors we see in the LGA scorecard. So you are expected to do that. You are expected to participate, and that's the one I'm mentioning, in structure review and validation sessions, data quality assurance activities we expect to see. So you can see that a health fellow has more than enough on his or her plate from 1 month to the other. And apart from that, you should also come up with your own, like your own pet project. So if I live in this environment, what am I thinking of? What can I do that can help to improve, even if it's just the health outcomes of your immediate environment? Think about that. So please, if you have run into any issue, any challenge, I know you all have Dr. Ashley's phone number or his contact. Feel free to just say, this is what I want to do. And these are the challenges I am facing. We know how we will handle it, such that you will not be identified as, someone who wants to put Plateau State in bad light. We will help you to navigate. That's why we're there. Discuss with your mentors. If the mentor is not able to solve the problem, escalate. I know, I've seen a lot of messages. Somebody did not get his allowance. Somebody's email is not working. All those things fathers complain of. If you can tell us about those ones, feel free to tell us about, those other things that will help you to achieve your results. Imagine what it will look like. I don't know, as Plateau State done the graduation ceremony for the cohort 1, you have. So imagine what it will look like when we come for the graduation for cohort 2. And we're finding it difficult to choose who has the best project among the 17 health fellows. You know why? Because all the 17 of you have done something so spectacular, something so impactful. But when it's just one person that has done something really innovative and impactful, that's easy. The person just goes home with gold prize. But when you have 3, 4, 5, 6, or 17 of you competing to be the award winner. When we come for the graduation, then that puts Plateau State, in the highlights, where we will be able to say, oh, see what is happening from just east to, is it Langtang? Sorry, I don't know all the names of the local government. Yes, then we are able to say the fellows for the second cohort of health fellows, they have done exceedingly well. Can you promise that we are going to get that kind of result from Plateau State? Health fellows, the ladies especially, stand up. I want to see you. At first, I thought it's only men that we have as fellows. How many of you are married? You have children? You know why I'm asking? Because when we talk mommy, we talk about mothers and their children, right? So you don't need to have been married and to have been pregnant and have children before you understand it. Think about it. What can you do? Imagine to make pregnancy safer for the women in your local government. It's little drops that make a mighty ocean. So whatever you do, is it just 4 women that we have? 4 out of 17. That's what's that percentage? I think you have tried. We say 30%. That's what we want, right? So you meet the minimum. I hope next time we are going to have a minimum of 50 or 50% or more as women. But I want you to take the challenge personally. That women, some are not as old as you are, some are older. When they get pregnant, it's another story. What can you do? I'm looking forward to seeing projects from 4 of you, especially. Projects that I will say, and I will be able to say, yes, when I went to Jos, I spoke to these people, and that gingered them to do something. Thank you, you can have your seat. So please, I want to appeal to all of us, from the community, to the primary health center, to the local government, to all our MDAs and the ministry. Our fellows will not be able to perform maximally without our support. I know we can count on our partners. All we need to do is to just link you up with someone and they will be able to help you. So please, let's rally around them and give them, let's open the door for them so that they can do what is expected of them. This is just one small aspect that can achieve big results of the N3. So out of the N3, we have the MAMI, we have the health fellow. The OPHC has a lot more. We've talked about the emergency. I was happy when they presented for Jos East, and I saw that a lot of hundreds of women and children are benefiting from the activities of NEMSAS. So I'm going to stop here. I don't know if there's Officer Ma. If we want to maybe take questions or comments or whatever for the Health Fellows session. So maybe they have challenges that they want us to address here in this room. And we don't want to wait to be sending emails. Your email will not be missing, don't worry. We will get it and we're going to attend to it.
So this is going to you straight if you have any gray area. If you have something you need clarification.
Good afternoon, everybody. I am Simi Dacholom, NHF Fellow representing your local governments. One thing I noticed is that the MAMI kits that they give to these PHCs, they are incomplete. And they are few. So some women don't get to have the MAMI kit. So sometimes, or a lot of times, they have to buy what should have been in the MAMI kit. So I don't know what the government is doing to address that. Thank you.
Good afternoon.
I also want to add to what she just said. During one of my visits, I asked, I had an interaction with both the pregnant women and the workers. And what they told me, the pregnant women, they said they are being deceived. That when they will tell them, come, everything is free. Then when they come, they'll tell them, okay, buy this, buy that. And they don't come prepared. So we want to know what is actually supposed to be in the mommy kits, so that when we go, we can also tell them, okay, this will not be there, then you need to buy it.
Any other one? I think you may respond to the two.
Thank you very much. Actually, before the commissioner left, I think, and the person from Ministry of Finance, I was asking them a question. You know, earlier on in the day, that presentation from the local government presentation, one of the challenges which I said I put under issues of misconduct was that they said some healthcare workers overcharge the clients. Some even took deliveries, collected money and put it in their pockets. So, after I made that my first comment, I started government should also have a CMON facility. You need to get the list of these facilities and focus first on those ones. They are supposed to have this kit. Do they have it? Now, that is the first question. The second question now is, does it contain what it should? BSCPF facilities have expected to provide what we call basic minimum package of care. So, which means they are supposed to have clients that are covered by health insurance. We need to find out. You see, that issue of people collecting money and overcharging needs to be investigated. Are they supposed to pay? I know that even if they are supposed to pay in every other facility, if you are enrolled in a BHCPF facility, those services, ANC, delivery, and all those things are expected to be free. Are people paying in those? Those are things we need you to find out. If you discover it, like you said, the lady from Rio, when you found out that the kit, it wasn't complete, women are still being asked to go and buy what normally is supposed to be provided for. What action did you take? So, no, I'm not asking her to answer. I'm just saying, so, because it's not enough to get to the facility and discover that, oh, this woman is supposed to have A, B, C, D inside the mommy kit. Inside the, I think it has a name, Mama something. But then you get there, maybe while you were there, you realize that they are still saying go and buy. You go to another facility, it's the same story. Then, what should you do? What have you done? Did you escalate? Did you tell anyone? Did you try to address the issue? So because BSCPF facilities are not only in Mami LGA, they are in all local governments, 1 PHC per ward, per political ward. Even now, I think we are upgrading to 2 per ward. So these facilities should have access to those things, be able to provide more facilities, services and all that. We need to find out, we need to investigate which facilities are paid, but I don't know what is obtainable in Plateau State. I know that for a lot of states in Nigeria, we say healthcare is free, but actually when we get there, we still pay. You take your child for immunization, they say vaccine is free, but you still part with some hundreds of naira because you need to pay for this needle and syringe and maybe pay for the card or what have you. And if you ask, they will tell you that it has not been provided for because they don't have it. So we need to really know what the case is in Plateau State. I don't know if anyone, maybe the PAMSEC will tell us what services are free and what is it that citizens are meant to pay for. I also know that even the health insurance does not cover everything. That's why we have the basic minimum. So that when somebody is paying for something that is already covered, they should know.
So good afternoon, everyone. Let me just clarify the issues on the health insurance gateway. So for the PHCPF, there's, like you said, there's a basic minimum package of health. And let me just tell the fellows that in every facility you go, it's expected that that basic minimum package of health is placed on the wall. We'll make sure that all facilities have it and it is placed on the wall. So any service that is on that list, any primary service that is on that list is 100% covered. 100% covered. Any other thing that is on that list that cannot be provided at that level, the person is referred to a secondary facility that has been accredited by NHIA. So it's very important that you know that, because I know one of the feedbacks we get from the communities is that a lot of the beneficiaries are shortchanged. We should also know that apart from BHCPF, like you said, there's also the health insurance, that's the state health insurance scheme. For this group of persons, they pay 10% of the cost of medicines for what is covered by the state health insurance. So it's very important that you know which group of enrollees are going to these facilities and what services they are supposed to get. But for the BHCPF especially, because most of the facilities, you call them BHCPF facilities, know that these persons are not supposed to pay even one kobo. Nobody should collect money from them. And we know that the criteria for enrolling these people into the scheme is first, they have to be vulnerable, and then under 5, pregnant women, persons greater than 65 years, internally displaced persons, orphans, verified orphans. So these are the categories of people. So it's very important that we don't shortchange them when they go to facilities. So if you see some of these things happening, please escalate it so that we can see how we can sort it out. Thank you so much.
Thank you so much for that, for saying that. You want to say something, Zaire?
Yes. Thank you very much. The PAMSEC present here and other directors. I want to respect the protocol that has already been established. I want to talk on the Mama Kit because there was a question on Mama Kit that the components are not complete. However, I would like to say that I do know that I'm speaking on behalf of the Plateau State Drugs and Medical Commodities Management Agency. And I do know that we procure Mama Kits and distribute to primary health facilities. Distribution, picking and packing and distribution is still ongoing. However, I don't know this observation whether it's coming from which, because I also know that there are other programs, there are other people that have procured mama kits and distributed. So, but to tell you our own, we got our list from the Primary Healthcare Board, and we do know that it's complete. The one you are talking about, I don't know until we investigate. However, it's good that you have brought it up, so we'll look at it and see, so that the correction can be made. But from us, the DAB, I do know that we have our list, which we liaised together, which came from the primary healthcare, which contain components that are enough by them. Okay, we only procure and distribute. So I do also, like I said, other people who distributed, brought in mama kits, so I don't know which one they are talking about. Thank you.
All right, thank you very much. So, Health Fellows, you see, some of the things I said earlier, you have to know what the policy says. You need to know. If you don't know what services are covered under the BHCPF scheme, even if you get to a facility and they paste something, you might think that is the complete list. So you need to know. You need to also know what is in what exactly should be in the mama kit. There should be like a picture or a list of what is expected to be there. This is Nigeria. Anything can happen between point A and point B. It can leave their warehouse and get to the facility complete. It might also not get to the facility complete. We don't know where some are missing. But it's important to, let me see, you know what they call you people? You are Tinubu's children. Nobody's going to talk. Nobody's going to harass you or label you or anything. They don't even need to know that it came from a health fellow in Plateau. We just need to say, this is what we had. You will just see some people from Abuja visiting and saying, let's go and visit this place and this place. It will happen randomly without anyone pointing fingers at you. That's our biggest fear. We don't want to be named. We are afraid. And I'm saying, feel free. This is on record. Feel free. Don't need to expose you. What if he leaves and they are waiting for me? Don't worry. We are also, many of us are parents. We have siblings. And we don't want anything to happen to them, just as we don't want to happen to you. So we will protect you, but let us know if you see such things. So I hope that answers the question. But please, sir, we need to know, is health service, healthcare in Plateau State, is it generally free? Even if, I know that for BHCPF, it is completely free, especially for pregnant women. From ANC to delivery, they are not supposed to pay. So if you get to a BHCPF facility, either for ANC or for delivery or for a child under 5, and they're asking to pay, and the person is enrolled, please flag it. It's not supposed to be. I think another factor is that people, the community people, are also not aware of what has been paid for. So, if you are not aware that I have paid for maybe a buffet for you, and you get to where they are serving the food, and the person service says, just take jollof rice, 1 spoon, and 1 piece of chicken, and 2 pieces of plantain. That's all you will take. You will not know it's buffet, and I am free to eat as much as you can. So help educate to shortchange them what they can do. You also need to help them to know. I hope I've answered your questions. Thank you.
I think she has been speaking for a while now. May we appreciate her with a resounding clap, please. Thank you very much, ma. You know, helping us to stretch, and that was why you could carry us along. But we'll be having presentation of awards, and now we'll invite Dr. Morina, the swab desk officer, to facilitate that. Please put your hands together for her once more. Again, she is coming on.
Good afternoon once again. So at this point, I will invite the Secretary to please come up, the Director of Planning Research from the State Ministry of Health, the Director SC MPACDA, and the State Coordinator WHO. Representing encourage. When we mentioned the need for the state to do the LGA performance dialogue, the LGA that quickly swung up to action before even us nudging and pressing on them is the LGA we're actually recognizing. And so I'll be giving the award to the Permanent Secretary. So please, with a resounding clap, let's acknowledge Just East local governments. The Director PHC Just East and the fellows from Just East. Please keep clapping till they get here. We'll have less red on our scorecard. Q. You can.
I'm seeing my sister is a bit excited. She never expected this. On behalf of the SWAP, this is an award of recognition presented to Just East LGA. In recognition of their outstanding performance, the 12th May of 2026. Congratulations, I present this in behalf of
Okay. Good.
Are you not inside? Yes.
Climb up. Behind. Good. We'll be inviting the national SWAP to join the picture. With personalities, who invite other heads of institutions. Good. Just press more so that she can. No. You come down. Let her. Just pace up small. Wow. One day it will be your turn, so go and take a cue and prepare for your honor award next. All right, the heads of institutions, kindly join, if you don't mind. The representative of the executive chairman, you can also join. Please. More people are coming, so just take your time and arrange. Some other persons can be, no. They can come down a little bit so that other people can be behind. Don't say ya be come on when you shopping mall. Now
Climb up.
don't worry.
Sorry, let me show you.